Hi, this is Dr. George Sanders. What is a fractional laser? On the surface of things, it sounds like something that doesn't do the whole job, just a fraction of it. You want it all done right, so why should you think about only a part of it? The reality, though, is that many times a part is better than a whole. Skin resurfacing lasers have been around for over 40 years. They remove the outer layer of the skin, resulting in an immediate smoothing out of the skin, much as a piece of sandpaper evens out a rough piece of wood. The original lasers gave you the whole result. It was like you were painting the skin surface with a laser paintbrush, covering every square millimeter. Healing took about 9 days, and there was redness that would take several months to resolve. The results were often very impressive. About 10 years ago, fractional lasers appeared. The first was a Fraxel laser. It was an erbium laser and was followed shortly by a carbon dioxide Fraxel laser. A fractional laser does not paint the entire skin surface. It treats only a fraction, usually 20 to 30% of the skin surface at one treatment session. It's like splattering a small amount of paint on a surface as you shake your paintbrush at the surface. It paints only a fraction of the surface. The process is repeated every 2 weeks so that after 4 or 5 treatments, you have treated the entire surface. The advantages to a fractional laser are that it only requires local anesthetic cream, and the patient has no crusting, oozing, or dressings afterwards. You look as though you have a mild sunburn for a few days, and there is some flaking of the skin the following week. The areas that are treated quite deeply, but heal rapidly because non-treated areas surround them. So which is best? The answer? It depends. If you have 8 days to heal, go with a traditional erbium laser. You'll probably get a better result with it, particularly in difficult to treat regions like the lips. Keep in mind, though, that you'll also need to deal with the pinkness of the skin that may last for several months afterwards, but that can be covered with makeup. Now, if you don't want to come back 4 or 5 times for treatments, go with a traditional erbium laser. One treatment and that's it. If you're having only a small area treated like the lips and lower eyelids, these can even be treated under local anesthesia. But if you don't mind multiple treatments and you like the idea of no bandages, no crusting or oozing, and no significant redness afterwards, go for the Fraxel treatments. As long as you're content with a lesser result, you may be very happy. Should you go for an erbium or a carbon dioxide Fraxel? Well, if you don't mind a longer recovery with some crusting, the carbon dioxide Fraxel may be the one. I personally prefer the gentler erbium Fraxel, but the more side effects like crusting that you endure, the better the result in general.